We knew that this is the beginning of something big. We knew that we're going to bring all our forces together. And we were really hoping to have a place where patients come in and instead of seeing one physician for one particular problem, see a group of physicians for their cardiovascular care and get the best care possible.
One of the things that's important to recognize about the Sulpizio, it's not just a center. It's a place where we can offer a multidisciplinary, state-of-the-art, individualized care for every patient. And the day we wheeled our first patient into the Sulpizio was very exciting for all of us.
Our hope was that no patient in San Diego County would ever have to leave the San Diego area for any cardiovascular care. And we accomplished that within the first couple of years and have just surpassed it by high-flying colors.
When the Sulpizio opened up, we built 7 dedicated invasive and interventional laboratories. We have the first hybrid operating room with a Cath lab built into an operating room in the region. We also have 2 dedicated electrophysiology labs and 4 interventional suites. During our decade of opening at the Sulpizio, we've had many firsts, many innovations, many things that we have done for the first time in the country and the first time in the world. One of those early successes was in 2013 when we performed the first robotically assisted coronary stenting procedure anywhere on the West Coast. Since that time, over the past 8 years, we have become the largest robotic assisted angioplasty program in the world. We train people from around the world. And what that particular procedure does is it enables us to treat patients with sub-millimeter level precision of care.
There are multiple areas within the Sulpizio Cardiovascular Center where we require a multidisciplinary team to approach the patient. But probably the best example of this is the CTEPH program or the pulmonary endarterectomy program, because here you have specialties not just from cardiology and cardiac surgery, where we work very closely together, but also from pulmonary medicine and pulmonary vascular medicine, radiology, cardiac anesthesia, and of course our staff.
We now do over 200 BPA procedures a year, matching very much our PTE volume of about 200 a year. And we've done over 500 procedures. We are the leading center in the United States for BPA as well. And we are training centers all over the country in how best to do that procedure.
One of the most distinguished accomplishments was the establishment of the STEP Family Rehab Center. Now we have multiple cardiovascular centers that are providing excellent care. And that really precipitated the notion to form a Cardiovascular Institute.
And it's not just clinical care. We've expanded our training programs. At any given time, we're training 30 fellows. And finally, I would say the third leg of that stool is our research enterprise. We have over $30 million a year in NIH research support for our research mission. I would say the way to think about the future of UC San Diego and our cardiovascular program is the Cardiovascular Institute, under which multiple clinical care centers, research programs, and training and fellowship programs reside.
Our pulmonary thromboendarterectomy program, which is a portion of our overall CTEPH program, has been known around the world to be the #1 center, and we're the gold standard. And in 2019, we reached a milestone of 4,000 of these operations. This is by far the largest number around the world. And when you hit a milestone like that, you reflect back and realize none of this would have been possible without the team around you.
We never lost a step during the pandemic. Our staff was extraordinary and made sure that patients with cardiovascular diseases in San Diego continued to get the same standard of care that was there before the pandemic hit.
In July 2021, our lung transplant program was ranked #1 in the country, and our heart transplant program was ranked #2 in the country in terms of outcomes, quality, and survival after transplantation.
One of the things that makes all of us very proud is since opening of the Sulpizio, we have continued to rank in the top 50 cardiovascular programs in the United States. We never ranked in the top 50 prior to opening of the center. And for our patients, what it tells them is they can come to the Sulpizio, they're going to get top world-class state-of-the-art care day in, day out, and it's highly consistent.
And now the question is, what do we see in the future? Since the day we opened, we've expanded and we've expanded more, but we really do need more expansion. And that's what I see in the future of the Cardiovascular Institute, a bigger center and continuation of the extraordinary care that we provide.
As I look forward to the next 10 years, what I would like to see is we should be one of the top 5 centers. So for every patient, every researcher, every trainee out there in the world, when they think of any of the top programs in cardiovascular diseases, they should be thinking of us, the UC San Diego Cardiovascular Institute. But over the next decade, we want people around the world and around the country to all come to San Diego to get our expertise.